you're probably seeing, there are parts of the country that are seeing spikes in COVID rates. Parts of the country that did not have spikes early on, that opened up their economies without any sort of gradual opening of the economy. No plans, no phases, just a sudden opening up of the economy. And these parts of the country tend to have Republican leadership. And now you're seeing these spikes where hospitals don't have beds, just horrifying numbers. And, I'm in Arizona right now, as many of you know, with my family. So I'm thinking about these things very closely. But there's also a congressional candidate that we've had on the show recently, Eva Putsova, who represents a swath of Arizona, from northern Arizona all the way down to southern Arizona, to the Oro Valley area. Eva Putsova, thank you for coming back. You're running for Congress in Arizona's 1st District. You are a former council member of Flagstaff. So if you look at a map, that's pretty far away from Tucson. But simultaneously, there's also wildfires here that are growing at a rapid rate. So all eyes are on Arizona, and I figured you're a great person to talk about what's happening.
Thank you, Nomiki, for having me. And yes, while today the national news covers Arizona extensively, for the last essentially 2-3 months, we've seen a huge uptick in COVID-19 cases. And specifically on the reservation, everybody heard that the Navajo Nation is actually #1 in its COVID-19 infection rate in the country. So even before Arizona became the topic of the national news, the Navajo Nation has been right in front of us as an area where we completely missed to protect people. And we see the rest of Arizona, because we opened up, even though before, different cities have obviously different standards of protection. Suddenly, for some weird reason, our governor thought, hey, let's just open things up. And then it's obviously not just the reservation now anymore, but it's also the rest of the state, that it's a hotbed of the public health crisis again. And what's interesting? So different cities, governor decided that, the cities now can regulate whether people are required to wear masks or not. And so cities around Arizona, those mayors who actually care about their population, issued proclamations in which they require people to wear masks. And so Flagstaff and Phoenix and actually Coconino County, at least those few I know of, there are more who require masks. And it's interesting, somebody pointed out that even when we have the same message, we don't have the same message, because different jurisdictions require wearing of mask starting at different age. So Flagstaff, it's from age 5 and above. In Phoenix, it's 6 and above. Coconino County is from the age 2 and above. So it's this is kind of emblematic of the fact that we have no system, we have no really public health system that all of us can rely on for good information, for consistent information, and for policies that would move us forward together.
I mean, it's astounding that it's not, the government here hasn't even been reactive. It's been ignorant to what's happening. They've been more concerned with business opening up and how it affects the economy, and less concerned about how the crisis, this health crisis, would affect the economy. I mean, there is a significant elderly population in Arizona. I mean, there's a lot of snowbirds who come down here to live. There are entire cities that are made up of retirement communities. And, we see that the rates will spike. I mean, in New York, there was a huge nursing home crisis that Governor Cuomo took, part in essentially covering up, that led to spikes and dozens of deaths. And we're seeing it here too. And these are our more vulnerable members of the community. But what's really interesting about these numbers is it's actually coming from young people, not necessarily because like young people are out partying or being ignorant. It's that they have jobs to go to. So if your business says, okay, we're opening up, as long as you want to stay employed, you have to show up, even if you don't necessarily agree. So it's putting people at risk, even if they're forced to wear masks as an employee, someone who's visiting that business may not be wearing the mask. And so, we know the rules now, we know how this spreads. And it's pretty jarring to see how incompetent the government has been. And now you have a Trump rally that is going to take place in Arizona. And we saw the last Trump rally. Well, the attendance was lower than, by far lower than they expected. Most people, pretty much almost everybody that maybe didn't work there, the rally was not wearing masks. And they were, even though the stadiums were empty, they were all squished together. And you compare that to, say, the protests where people are wearing masks, and they see that because people are wearing masks, these protests, you're not seeing a spike, but it's likely to be just the opposite with the rally. And so, with Arizona in crisis already, in a health crisis, and then seeing a rally like this exist, it's continued to be planned. What are you hearing? How are our leaders that believe that this is a health crisis, believe in science, how are they responding and reacting to what's going on?
So frankly, I do think that we have a huge void of leadership when it comes to the COVID-19 pandemic. And, it's been almost from the beginning, and it's, the combination of lack of leadership at the national level, at the state level, even at the county and local level. And I really think this is a problem. And, the COVID-19 pandemic also illuminated the huge deficiencies we have in protecting labor. The fact that businesses can open up, and even if they require the employees to wear masks, the businesses are hesitant to require the customers to wear masks to protect their own employees. And there is no force locally, at the state level, at the national level, that is going to say that, no, you cannot allow customers who are not wearing masks into your business. And so again, we are putting profit, and I should say short-term profit, because this is not good for business in the long run either. The longer this crisis persists, the worse the economic impact will be on the businesses. And so we do have to, there is, what I hear is that there is interest in strengthening these labor protections. And, it's not just in businesses that you would expect, like restaurants or retail, but also our universities. Mm-hmm. Faculty at the Northern Arizona University, and I'm sure that it's the same at ASU and UOA, are so worried because the president said they would open up the campuses to student population this fall, which, this fall is going to start in early August for the universities. So they are concerned that there is no way to enforce social distancing. They're concerned how they're going to enforce as instructors, as faculty in the classrooms. And it is a big mess. That's what I see. And I am very worried that instead of, this crisis being a 6-month, maybe, 8-month, 12-month crisis, we're going to be talking about this next year around this time again.
Thank you for watching and listening to the Nomiki Show. Make sure to click like and subscribe on YouTube and share with everybody on social media. And of course, if you're not a patron already, please join us on patreon.com/The Nomiki Show for as low as $5 a month. That money makes a huge difference. We don't have the corporate money coming in. We're not cable news that's raking in the dough from advertisers right now as everybody's sitting at home and watching. It is really you guys who are keeping us together. So please consider being a patron. And for those of you who have already, we are incredibly grateful to you.